Today we're talking to Emma Hosking about systems leadership. Hi Emma.
Hi Lorelei.
So you're a doctor,
Yeah.
you're a consultant anaesthetist,
Yes, that's right.
but you're also medical director of an integrated care community here in North Wales.
Yes, that's right, yeah.
Tell me a little bit about your role.
Okay, so we have, I work for Betsy Cadwallader University Health Board, and there are lots of different bits of it that all hang together, but there are 3 integrated health communities, and the one I work for is based in the east, so we look after the populations of Wrexham and Flintshire. And in the integrated health community, we have responsibility for everything that happens in primary care, in community care, in the community hospitals, in the district general hospital, and also in our case in the prison in Wrexham, which is quite an unusual thing to have in a portfolio for a medical director. And so as the medical director of all of that, I have overarching responsibility for professional standards, for quality and safety, for making sure that our medical workforce is appropriate for the needs of the population, and working really closely with other very senior clinicians and a senior operational manager to make sure that voices are heard from across the medical, nursing, therapies and pharmacy communities.
Mm-hmm. So it's like a really big team.
Yes, it's led by a director who is also a doctor, and then there's 5 directors, of which I'm one, and then we have lots of people that work with us, alongside us, to drive it all forward.
And for you, what's key to working with other people to improve population health? I mean, we're particularly interested in improving population health.
Yeah, I think one of the really important things is to recognise that that really good healthcare is a continuum. So it starts with prevention,
Mm-hmm.
and that's as much a socio-political entity as a health entity. And I think some of the challenge of being a medical leader in this environment is helping other medical people to understand that that's the case, and that's where the attention needs to be. And then moving forward from prevention, we've got the sort of public, part of which is public health, but we've also got the elements of primary care and moving through to secondary care services, which might be based in communities, but also might be based in hospitals. And I think as a medical leader, it's about working with other doctors to help them to get that understanding of the whole patient pathway and the whole patient journey, rather than perhaps focusing on their very specialised area of practice.
Mm. I really like this idea. It feels like the patient is being put back together, so you have a more holistic understanding of the patient.
Yeah, and I think that it's easy to get really focused on the work that occupies and preoccupies you on a sort of hour-by-hour basis, but actually to be truly effective and to make a bigger difference to a larger number of people, you have to be able to sort of pull back from that and recognise that sometimes perfection is the enemy of the good, you know,
Yeah.
and sometimes we need to change our focus to bring as much benefit as possible to a larger number of people.
Mm-hmm. And so why is it important for doctors to be thinking about systems?
I think for me, a lot of it's about context. So, you can do, for example, a really sophisticated operation, but if you're sending that patient back out to a system in which they don't have good rehabilitation, or they don't have good family support, or the primary care in their area is inadequate, then actually they're probably not going to get such a great outcome.
Mm-hmm.
So doctors need to kind of be in touch with all of that. And what I've seen over the years is the doctors who I think of as being the most successful of all are not necessarily, although they often are, the most gifted at the small thing that they themselves have got real expertise in, but they're really good collaborators. And they work across professional boundaries, and they engage people at every level to really make a difference.
So what I like about systems leadership is that you don't really need to be interested in management to be doing systems leadership. You just need to be interested in collaboration.
Yeah, I think that's true, and I think you need to be able to articulate a vision. So a lot of medical leaders, they don't really need to get embroiled in the management in the traditional sense of what's happening, and because there are others who are really, really good at that. And actually, in an ideal world, progress and developments can be medically led or clinically led, but operationally delivered. So what's really effective is when you've got somebody who can absolutely articulate an entire patient pathway, has got agreement with their professional peers and their clinical peers, and then you've got a team of managers who can see it, who are raring to go and want to bring it to life for their clinical colleagues, and that's when it really, really flies. If you ask doctors to get embroiled in the operational nuts and bolts, it doesn't always go so well.
Yeah. One of the things we've been talking about in this course is mutual appreciation, that process of understanding where the other person's coming from. So if you're a doctor, it's understanding the perspective of managers.
Absolutely.
And managers then understanding the perspective of doctors.
Absolutely.
What else is important?
I think that doctors have to keep an open mind about challenges that other doctors are facing. So we sometimes unfortunately get into difficulty when doctors based in hospitals feel that doctors based in primary care should do certain things, and doctors based in primary care think that actually that's a job for a doctor in secondary care to do, and that people are sort of trying to push work in either direction. And I think in those situations it's the job of medical leaders like myself to actually help people get into a room together and really, really listen to each other, because on the face of it these things can look very binary, but actually when you get underneath and you really listen, it's much more complicated than that. And I think that people get quite embedded in their work and their own particular challenges, and perhaps sometimes need a bit of help to see where things are tricky elsewhere in the system.
Because I think traditionally some of the problems we have across systems is when different groups like primary care or secondary care doctors say, well, the problem is they're not doing their bit.
Absolutely. And actually, when it works really, really well, it becomes so beautiful because you get a secondary care doctor and a primary care doctor who actually listen to each other with fascination, to use the Michael West phrase, or Nancy Klein, I think, and then it just gets unblocked, and you can see that actually there's a win-win solution here that's going to benefit everybody, but it's getting over that.
You mentioned Michael West, and he's known for compassionate leadership and compassionate culture, and that's something you're very interested in.
Yeah, I am. I mean, I think that, he's done such a huge amount of work in this area, and I think that again, one of the roles I think for a medical leader is bringing that balance of challenge and support into almost every conversation you have. And I think one of the things that perhaps is sometimes challenging for doctors is understanding things like assurance. What does assurance mean in the context of clinical governance? How can you show to an external person or even to your peers that actually what you're doing is making a positive difference, or what you've done has affected change that is measurable and demonstrable, because everybody works really, really hard, and on a patient-by-patient basis they will know whether something's gone well or not. But sometimes when the external view is there, and you need to be able to say, no, actually this is going well for all of them, it can be harder for people to understand that that's even required at times.
I think again that's that mutual appreciation. It's appreciation what regulators need or what the board needs.
Yes.
And if the board's asking for this, for information in a particular way, it's not necessarily because they're trying to be top down for the sake of it. I think that there is accountability structures and understanding those accountability structures as well as, and doing that alongside of collaboration. And I mean, they both exist, don't they?
Yeah, and I think what can be really, really hard for doctors, perhaps particularly, and honestly I think nurses are much better at this than doctors, is that in your postgraduate medical training, you jump through a lot of hoops and you do a lot of things to provide assurance that you're good enough and that you're good enough to progress and that you're good enough to become a consultant. And then you reach the consultant level and the need to provide assurance doesn't go away, but it changes very dramatically. And in an enormous organisation like the one I work for, there can be quite a distance between doctors on the ground and the board. So the desire for accountability and assurance is filtered through many, many layers. And so it can be really difficult for doctors on the ground to understand what it is that a board wants from them. And so it's a key task for people that do my kind of work to do that translation piece. I think you've talked about this, haven't you? That translation, this is what they need and this is how they need it. And then to accept that sometimes that doesn't land very well and that you have to be quite patient and quite considerate of the fact that this feels really difficult for people.
What I like about this conversation is you've reminded me of something really important, and that is that whenever I talk about systems leadership, and when we've been talking about systems leadership in this course, we've been talking about collaboration. We've been talking about all those things that make collaboration work, good relationships, the mutual appreciation, having the institutional structures in place, transparency, all those things that, and the leadership, which is why we're talking to you, the leadership that upholds all the things that make collaboration work. But the thing about the NHS is that, our integrated care communities don't exist in a vacuum. There will always be hierarchy as well.
Yeah.
And in the NHS, you won't get rid of hierarchy because the minister is accountable to the population.
Yeah.
And so it'll always be there. So it's always, one alongside the other. And talking to you has reminded me of that. And I guess as a systems leader then, you need to be quite versatile, moving between collaboration and hierarchy.
Yes, I think that's right. And I think, again, the tension can come from an environment in which, again, perhaps particularly for doctors who spend, up to 15 years sometimes training to get to a point where they've got autonomy and then realising that actually autonomy is always relative and autonomous clinical practice still has to sit within a context of organisational governance, integrated governance, accountability, assurance, and those things are quite nuanced. They haven't traditionally been taught, I would say, in postgraduate medical education. And because most doctors reach a level of consultant practice, certainly, not perhaps so much for primary care, but it's unusual to have a consultant get their specialist accreditation before their early 30s. So you've had quite a long period of time without that specific level of education going in. So you're starting at it's all quite new, and I think that's hard because at that point you kind of feel, I'm here now. I'm clinically trained. I'm a certified expert, but actually there's a whole other learning curve that is enormous. And when I think about when I first started out as a medical leader, how little I knew about all of that, and how much attention I've needed to give it, and how it's something you can't let slide in your leadership practice. You've got to be all over it all the time, and the nuances change, and the structures change, and the individuals leading those structures change, and you have to be agile. to give them what they need.
So what I want to do with this course is really encourage doctors to think about systems and systems leadership. I think, when you go into medical school, you don't necessarily think, I want to be a systems leader. You think, I want to provide good quality care to the patients I see, and I want them to benefit, and I want them to flourish. Why is systems leadership important for doctors? And I know I've asked you this, but in terms of encouraging them to think about it, what are the benefits that you see?
I think that there is a deep, deep joy and professional satisfaction in looking after one patient at a time and being able to go home at the end of the day and know you've done a really good thing for that person. And that's what I have in my clinical practice. But for some of us, the wider and more enduring satisfaction comes from shifting the way a whole service is delivered. So an example I like to use is that, and this is old hat really now, but when I started out as a consultant, the whole concept of doing operations for people and sending them home the same day, admitting them and operating on them and sending them home the same day, was not widely accepted, certainly in the UK. And to have been involved in shifting the dial of that and making it the norm has been enormously rewarding, because you can see then that what you're doing is enabling people to get back to their lives more quickly, to not become institutionalised, to be with their families, to sleep in their own beds, and that's been made possible partly by shifting mindsets and moving perhaps away from paternalistic medicine, but also by using better drugs, better techniques, by encouraging surgical colleagues to perhaps use techniques that are a little bit less invasive and things like that. But it's the whole system, and that I think brings a different kind of reward, which when you look back on a career, I suppose, it's lovely to have a balance of both of those things, which you can have as a doctor in leadership.
Looking at your online profile, you describe yourself as experienced, inclusive and collaborative in terms of your leadership. And I love that. I think about that a lot. I think that is one of the benefits of being a doctor in leadership, is that you bring experience of clinical practice and the way work's done on the ground. I also love that you describe yourself as an inclusive and collaborative leader, because I think that culture, when you work in that culture, that brings a joy.
Oh, definitely.
And it brings benefits to staff.
Yeah.
As someone who, we've got a great team, don't we, Imi? So we have a very collaborative team at Bank University, and it really is a joy, and I can see, the benefits for me, but I can see how much energised it makes me in terms of the work I do, and I think that in itself can help to engage your intrinsic motivation.
Yes, it does.
And in medicine, that would be that intrinsic motivation to do the best for the patient.
And the current team I work with, it's an absolute joy, because to have an expert leader of allied health professionals, an expert leader of pharmacists, an expert, hugely experienced director of nursing colleague, and a very experienced operational, there are days when I'm sort of really struggling with something and I can't quite, I know there's an approach somewhere over here that will be worth taking, but I can't quite get there on my own. And I can go to that group, my peers and my director, who we all report to, and say, I'm really struggling with this. Can we just talk about it? And within about half an hour, we'll have come up with, using kind of quite a casual action learning type approach, but I will leave that conversation so much clearer, because the experience they bring, the knowledge they bring, slightly different way of looking at it, but still with the same desire to get it right and to improve things, is absolutely invaluable. And you just cannot overstate the value of that, I think. It's very lonely trying to do things on your own. And some of this work is really hard. And so when you work with people that you know you can collaborate with, it's kind of a beautiful thing, really.
Thank you very much for talking to us
welcome.
today about systems
You're welcome.
leadership.
It's been a pleasure.
I really enjoyed it.
Okay.